Welcome back. I'm Mabel Jong, and thank you so much for watching Day 2 coverage of the World Healthcare Congress. I'm here now with Stanley Bergman, who is Chairman and CEO of Henry Schein. Good morning, Stan. How are you today?
Good, Mabel. Excellent, thank you.
Well, your message here at the Congress has been really about just giving oral health more visibility and why we need to continue to think about oral health as important as any other type of health care. Tell me why that's so key to the discussion.
So Mabel, our company, Henry Schein, is the largest provider in the world of dental products, products to veterinarians, and to physicians outside of the hospital. And on the oral care side, we believe, and there's a book of literature that's come out in the last decade proving that there's a direct correlation between good oral care and good health care. We need to get the message out that if people take care of their teeth, they are going to have a healthier life. And today, over 3 billion people in the world have caries. That's at the heart of bad teeth. And if we could just impact that slightly, the quality of life will be much better for people in the world.
Well, as we look at reform in our overall healthcare sector in the United States, are we seeing oral health care being pushed up in the discussion at all? And if not, why not?
Well, we are, but we're just peeking into the tent right now, and it's not happening fast enough. The literature has only started emerging now in the last decade, and the notion of wellness and prevention is new. It's really only in the last 20 years. Healthcare reform is about prevention and wellness, giving everybody in this country access to a primary care physician, not dealing with people's issues when they get to the emergency room, but preventing people from getting sick. Oral care is one of the top preventative diseases that we need to focus on, NCDs. And it's only now that insurance carriers, the government, public health people are pushing oral care as an NCD.
Why has it taken so long?
It's a good question. I think it relates to the fact that the literature is relatively new. I think, on the one hand, the dental community was not quite there, that dentists are really part of healthcare, and the physicians didn't quite understand why oral care is important. It's starting to come together, and it's being driven by the payers and government. Healthcare reform has provision for, of course, prevention, wellness. Dental care is in that right now, minimally, but it's there. And it's taken a long time to get that in the conscience of the public.
Well, as the largest distributor of healthcare products in the dental space, what have you seen the most growth in?
Well, on the oral care side, of course, the big opportunity, like in every part of society, is digitalization. The interoperability of various devices with computers and telephones. And in the oral care space, we're seeing huge amounts of progress. So we're seeing a computer, which used to do the billing, still does, but now has an electronic medical record, and associated with that are the various devices. So today, one of the devices, for example, is a CAD/CAM machine to replace the impression material. You can take a scan, the scan goes to a computer, could be sent to a lab so that the prosthetics are manufactured, milled in the lab, but also could go chairside, and you can have a crown, brand new crown and bridge within 1 hour. Wow. Chairside. And that's how we're advancing in technology, and that's our biggest growth area today.
Do you believe that there is adequate leadership in the oral space area to really get people to be talking about dental care, oral health care?
Well, we're making progress, but what we are now advancing together with some very progressive companies is an umbrella group that is working with insurance companies, with the public sector, NGOs, government, state, local level, on a global basis to advance the notion of good oral care equals good health care. And we're seeing some top leadership on the business side coming into this as well, I might add, as academia who are driving this.
What do you see the reimbursements looking like in 3 to 5 years as we get more people discussing payments and payment reform in healthcare?
Yeah. So in healthcare, obviously, what we are now doing is driving toward outcomes. Yes. Well, actually, that's the second phase. The first phase is to prevent people from getting sick. And you know, 60% of the healthcare budget expenditure is tied up in NCDs, non-communicable diseases. So we're starting to see the payers and companies that are funding the payers align interests to make sure that we are now preventing people from getting sick.
Yes.
So those are the incentives. So it's no longer only fee for service. Now we're incentivizing the actual providers of healthcare to prevent people from getting sick. So I see in the future much more emphasis from reimbursement on prevention, and therefore cost per procedure is going to go down.
Okay.
And it's actually the only way we're going to be able to afford healthcare, because what's happened, it used to be a triangle. We used to have a lot of younger people at the bottom and a few over 80 at the top. It's now a square, with the top part being the over 80s. Those over 80s need to stay alive.
Right.
So we're going to spend a lot of money on them, and the only way to balance this whole budget is to prevent people from getting sick and not only taking care of people when they're sick.
What is the key takeaway you'd like people to have from you at this meeting?
Well, this meeting, of course, oral care is important, but this meeting, and I was just on a panel, was related to emergency response. The notion that the world is not prepared for the next Ebola, and the notion that public-private partnerships can work together to ensure that we can get infection control products to emergency sites right away.
Right.
And so we could, if we'd done this in the Ebola time, we could have prevented thousands of deaths
Yes.
by finding a way to make sure that people had the resources to wash their hands and, of course, prevent the spread of Ebola. And we are, the key message I had at this conference, together with Ethren's Cousins, who
Yes.
is the head of the World Food Program, is to figure out how to get the products there. And the World Food Program moves about 30% of all emergency products today. So working with her and President Kikwete, who is focused on emergency response right now, to put together a program of the multilateral organizations, countries, and the private sector.
What makes you interested in putting this event on your calendar, Stan?
Well, I was invited here to participate in a discussion on emergency response. And I will go anywhere in the world to talk about it, because I am fearful that we are sitting on top of the next pandemic. And you know, infectious disease, we spoke about prevention, that's the other side of the house, but infectious disease knows no borders. And we need to be careful. It's in the enlightened self-interest of the wealthy countries of this world to make sure that we stop infection control right where it starts. And one of the biggest challenges we face in the world is we all understand failed states from an economic point of view, from a military point of view. We do not understand failed states from a healthcare point of view. And if we don't deal with that, as Ethren mentioned in the panel I was just on, we will not build fences and walls high enough to keep the infection out of this country and the developed world countries. And we're sitting right now on the biggest migration of refugees ever.
Yes.
The impact of that on the developed world and on the whole continent, on the whole world. We're not going to stop it in Africa, the continent of Africa. The whole world is going to be impacted by this. And if we don't deal with it, we're going to find ourselves in real trouble. And I'm deathly fearful that we are on the cusp of a serious pandemic. And I feel, as a business person that has occasionally a podium, that we've got to get the wake-up call out.
All right. Stan, thank you so much for your comments today. I really appreciate it.
Thank you, Mabel. Thanks.
And I'm Mabel Jong. Thanks for watching.